I am DyAnna Gordon, an international board-certified lactation consultant, certified professional midwife, and graduate student in public health. Following is an informative and very brief presentation from medical care providers on identifying antenatal risk factors for delayed lactogenesis 2 and breastfeeding complications. Identification of risk factors prenatally by a medical provider can help a pregnant patient prioritize a visit to an IBCLC before delivery in hopes of minimizing complications that can come from delayed lactogenesis and breastfeeding. Lactogenesis 2 is defined as the onset of copious milk production. This typically occurs between 48 and 72 hours postpartum. Onset after 72 hours is considered delayed and is associated with unintended breastfeeding reduction and cessation. Delays in lactogenesis occurs at a rate of 23 to 44% in the United States. The American Academy of Pediatrics recommends that infants be exclusively breastfed for about the first 6 months, with continued breastfeeding along with complementary foods for 1 year or longer. Currently, 84% of U.S. women initiate breastfeeding at the hospital. Parents in the U.S. are not meeting the AAP's breastfeeding goals, as only 25% of babies are exclusively breastfed at 6 months, and only 35% of babies are still receiving any breast milk at 1 year. Generally, we can conceptualize the problem of failed lactogenesis as preglandular, glandular, or postglandular. An example of preglandular would be hormonal causes, such as retained placenta or lack of pituitary prolactin. Glandular causes might be surgical procedures, such as reduction mammoplasty or possibly insufficient mammary tissue. Postglandular would be any cause for ineffective or infrequent milk removal. As the patient's care provider, you can appropriately identify risk factors prenatally, and the patient may be able to meet with an IBCLC prior to delivery. Following are some identified risk factors that may be identified during an exam or medical records review. First is a history of present illness, gestational diabetes, a first baby, a young mother, advanced maternal age, high gestational weight gain, preeclampsia or pregnancy-induced hypertension. Past medical history risk factors might include diabetes, type 1 or type 2, hypothyroidism, in vitro fertilization, polycystic ovarian syndrome, maternal pre-pregnancy obesity, or prior breastfeeding difficulties. Past surgical history such as a breast reduction or breast augmentation. Medications like Abilify, allergy meds, or hormonal contraception. Risks identified during a physical exam might include flat nipples. If the nipple does not become erect, then it is considered flat. Inverted nipples. If the nipple retracts or becomes concave, then it is considered inverted. Large nipples or cesarean birth. On this slide are included some newborn-specific causes. Many causes you won't know until after the baby has arrived, but some of these might be anticipated antenatally. They include a planned cesarean birth, an anticipated preterm baby, anticipated baby with special needs, a baby who has an expected birth weight to be over 4,000 grams, or multiples. In addition, I'm including the most common postpartum causes, as more knowledge is always helpful. Poor milk removal, retained placenta, cesarean birth, NICU admittance, postpartum hemorrhage, a long second stage of labor, and prelactal feeds of water or formula. How can you help refer a patient to an IBCLC? The Affordable Care Act establishes health insurance plans must provide breastfeeding support, counseling, and equipment for the duration of breastfeeding. These services may be provided before and after birth. If the patient's health insurance plan is grandfathered in, meaning it was established prior to the Affordable Care Act, then they are not required to cover lactation. but all plans created after the Affordable Care Act are required to cover lactation appointments. Your patient can find an IBCLC by contacting their insurance provider. Some companies require the use of an in-network provider, and so this is a good first step. Or they can search on the International Lactation Consultant Association website listed below. An additional benefit of the patient seeking lactation care antenatally is that the patient will have advanced knowledge if their health insurance makes accessing lactation care prohibitive or difficult. It is much better to learn how to utilize the system before there is a newborn and an emergent lactation concern. For your benefit, the final slide lists some of the articles referenced in establishing this list of risk factors. Thank you very much for your time and attention. A small utilization of your examination time and medical records review time may have a positive impact, with the ultimate goal of an enjoyable and successful infant feeding experience.